I normally start, because we're a really small group, with introductions, just because it's really helpful to know who's in the room. So if it's okay, Sam, would it be all right if people just switch their cameras on to do the introductions? Because I think we're a small group and I think it always helps if we know who each other are.
Absolutely.
So I'm Mary Jarrett and I'm Head of SEND at Haringey Council, and I'm going to introduce my colleague Amanda, and then if it's okay with people, I'll just call out using the team script, because otherwise I think we all jump around differently on people's screens and it gets really confusing. So Amanda, would you like to introduce yourself?
Hi everybody, my name is Amanda Bernard. I am the chair of Send Power Parent Carer Forum in Haringey.
So we've got Amanda from Kent.
Yeah, I'm Amanda. I'm from Kent Pact, which is the Parent Carer Forum in Kent.
Caitlin. Can't hear Caitlin. I missed that, but maybe you could put it in the chat. Alice.
Hello, I'm Alice Clegg. I'm a commissioning officer for Cumbria County Council.
Jane.
Hello, my name's Jane Hankins. I'm the designated clinical officer for SEND for Derby and Derbyshire.
Helen.
Hi, I'm Helen Hayes. I'm Commissioner Manager for Children's Services in Wirral Council.
Karen.
Hi, I'm Karen Wilson, Clinical Lead for Children's Young People Continuing Care, covering Derby and Derbyshire area.
Patricia. Can't hear you, Patricia. I think your mic's poking upwards. I just know this because I do it all the time. No. Do you want to pop it in the chat? Paula, would you like to introduce yourself?
Hi, I'm Paula Vise. I'm designated clinical officer in Surrey Heartlands ICB.
Yeah. And last but not least, Sam, and you have to tell people how long you've been in your job.
So I've been working at the Council for Disabled Children for all of 4 days. Yeah, it's been great getting to know what the Council for Disabled Children do. And before that, I worked for a voluntary sector organisation in Cambridge.
It's really nice, and I think you're doing very well on your 4th date, to be fair.
Thank you.
So if you'd like to bring up the slides, Amanda and I are going to take you through really just our learning and some of the tools we've used to help us really get to grips with what's been a really challenging couple of years in Haringey. So these are the lessons we've learned. I'm really happy to take questions at the end, and there'll be a bit of an opportunity to share some of the tools we've used as well. So on to the next slide, please, Sam. So I'm going to hand you over to Amanda, who can just tell you a little bit about how it's been. Sorry, Yvonne.
I was going to say that somebody was missed.
Oh, so sorry. I'm so rubbish on Teams. Please, can you introduce yourself?
Hello, everybody. Yeah, I'm Yvonne. I work for Shropshire Council and I'm the Children and Young People's Commissioning Lead.
Thank you. We've got a real mix of people here. It's a really good workshop. So Amanda, just say it as it was.
So our parent experience pre-Ofsted, when was that? July 21, communication with the local authority was really poor, and as well as from a parental point of view, so with the services, relationships had really broken down between parent carers and the local authority, as well as amongst parent carers also. And the experience of being a parent for a child with SEND was extremely adversarial, and the constant fight. I mean, we're still fighting in some shape, way, or form, but there's always that constant fight to get the needs of your young person, your child or young person met. So yeah, battling for everything is no fun all the time. Next slide, please.
So the local authority journey was equally fraught. We knew we weren't getting it right. We knew that relationships between the council and parents were increasingly dysfunctional. We stopped doing stuff that we should be doing. Officers stopped wanting to participate in meetings because, you know, they were being met with a lot of very angry parents. It became really very entrenched and quite unhealthy. So as a first step, the local authority commissioned an external provider to come in and just do a report. So brought in a maze, and they did a series of workshops with parents. They basically exposed the situation for what it was, but also looked at some of the causes and some of the ways in which the breakdown in relationships were being manifested. And hi Sarah, sorry, I've just seen you arrive in the chat and I'm sorry I missed the introductions. So that provided us with an action plan and a roadmap and some sense of some of the things and some of the mechanisms that we needed to put in place to make this functional. Almost immediately, and in the context of global pandemic running alongside of all of this, Ofsted arrived in June 2021 when I'd been in post, I think about 3 months at that stage. And to some extent, that was very cathartic. We had 200 parents respond to the Ofsted survey about the state of SEND in Haringey, which gave us a huge platform to then say, okay, so come and tell us it like it is. And it just set out the agenda that this far and no further, this is where we are, and this is how we're going to need to approach the next steps. So next slide, please. So what we did was we embarked on a programme to restart our PCF, but approaching it very differently from the way we had before. So what we'd had in Haringey, and we have a long and proud tradition of activist groups, was we wanted to put some structure and support around the Parent Carer Forum to help the officers of that group have the support and the services and become more equal through having access to things like an office and desks and support staff and people to pick up the phones. So we put in place a small but sufficient infrastructure grant, but we didn't want to make the decisions local authority about the specification or who to award it to. So we made the sum of money available and worked with the parent carers to think about commissioning this. I'm going to hand over to Amanda to talk you through how that worked.
So once it started with a series of consultations, and eventually we were in a position as parents, certainly parent carers, we were in a position to procure a host provider to help us set ourselves up as a parent carer forum. Between September and January, the local authority had put on a series of participation events, 3 participation events, which for looking at how co-production could work and what co-production really is. So this happened in the November 2021. Local authority officers, parent carers, and health professionals. It was really quite, it was a great event actually. We actually were able to iron out a lot of things. And so that culminated in January, the Parent Carer Forum being, we were able to get ourselves a steering group, interim at that point, and start to amass parents and carers' views so that we could have some co-production with the local authority. Next slide, please.
So do you want to talk us through the early days of a nascent PCF, Amanda, with the complete, I think all the historic issues you were left with when you restarted?
So to begin with, there were many difficult conversations and a range of different, almost adversarial views amongst the parents because of the breakdown in the relationship between us and the local authority. So starting the parent carer forum was really quite difficult. A lot of parents were not really wanting to engage, thinking it would be the same old thing as before and nothing would happen. We needed to really manage that historic breakdown of trust, which really it isn't very easy. We still have issues a year and some later, we still have issues with trust. Finding out what parents wanted from us as a PCF, we decided that we would do a range of events where parents could come and air their views. We also have a monthly walk and talk where parents can come into one of the parks in Haringey. Every month we visit a different park, and just allow parents to kind of have a safe environment to speak openly, to be able to express themselves and know that it kind of goes no further, especially if it's really personal stuff. But as a PCF, we're able to represent those views in a number of ways with the local authority. And the most difficult thing for us is managing the local authority's expectation. I often say to Mary that the local authority have hundreds of employees and many departments. We have 10 volunteers and 2 paid members of staff, and it's not always easy to be able to be at every subgroup meeting or have representation at every subgroup meeting. We can't kind of do it as much as parents want it all done now. From a personal view, I've been kind of fighting this fight for 22 years now. So, co-production after 22 years is in a much better place than it was, but still we can't manage to do everything at once, but we're working to get there. Next slide.
So one of the things that we really realised very early on is just goodwill isn't enough. People talk about co-production a lot, and I'm sure at some stage Amanda will give you her views about the misuse and overuse of that term, both within the local authority in Haringey and in the wider SEND world. But we needed some tools and some rigour applied to this. Wasn't enough to just turn up and smile at each other. We really did need to understand where we were on the co-production journey and where we needed to be. So the first thing we did as local authority was we brought in Genuine Partnerships, who are an organisation I've had links with in a previous authority, to come in and train my services. So I'm a great believer that you can't change an external culture. We couldn't change the culture in SEND until we addressed our cultural issues within our Haringey SEND. We'd become very entrenched, very defensive, people relying on an expert position without perhaps always acknowledging that parents are the experts in their own children. We had become a bit us and themmy. And there was a whole way in which I think we used language in a way that was unhelpful. And there were some basic things that we'd stopped doing, like having co-production meetings as part of the statutory assessment process, sharing reports with families before they got them in the post. Just real basics had got lost somewhere along the way. And I don't think the pandemic had helped with that. So we used a tool I'll share with you later, which is the Genuine Partnership Self-Evaluation for the SEND service, which breaks down values into behaviours and actions. And how do you know you're doing co-production work? Well, actually, these are the things you're doing. This is how people will be able to see and know and feel that the culture's changed within the council. The other part of the work that we did was thinking about how we would work together as a parent carer forum in the council. So we soon discovered that having meetings to talk about co-production wasn't really co-production, but actually developing a shared project together and working through that, taking roles and responsibilities, setting agendas, chairing meetings together. All of that work to set up our Voices Day has brought us much closer together as 2 organisations, but also from a council perspective. For me, part of the journey has been letting go of my tick lists and my project plans and my accountabilities frameworks, and going with the fact that we're on a journey to a Voices Day where the system will come together and talk about what co-production looks like in Haringey. And that's not my agenda to set as a council leader for SEND. It's about sharing that journey, trusting in the process, and then working together to deliver the outcomes of that day. And that's a significant mind shift within a very busy local council office. So on to the next slide, please. So Amanda, do you want to talk about this?
Yeah, thanks, Mary. So as a fledgling parent carer forum, we also decided to arrange some training with genuine partnerships. We needed to be, looking at our values and what we wanted to achieve as a forum. And it was really very informative and was really very helpful in kind of focusing our vision and our aims, really. Getting to know people was really a bit of a challenge. I often say that we were like a pop idol band. We were just this band of then 6 or 7 parents that were just kind of thrown together and were expected to represent the voices of 3,000 families in Haringey. And that's really very difficult because we are probably one of the minority boroughs in London that has 180 languages are spoken in Haringey, and it is a huge borough. So being able to cross those language barriers and community barriers has started to make a really big difference for the lives of parent carers and also for the young people. Another significant thing for us is having a seat at the important planning and kind of strategic subgroups. So we sit on the health subgroup, we sit on the parent preparation for adulthood subgroup, transport, and we're also on the SEND exec. The other thing that we kind of really felt that would be of benefit and to kind of keep the local authority, being able to hold the local authority to account, was securing ourselves a co-opted seat on the Children and Young People Scrutiny Panel, which is really a great move, and I'm not sure how many other parent carer forums and local authorities have achieved that, but it really makes sure that our voices are heard as well as listened to. We've still got a really long way to go, and sometimes even I'm impatient and kind of tell Mary off if I think things are not going at the speed that they should be. But we are making inroads, and slowly but surely change is beginning to happen. So yeah, we're a little bit more patient than we were, say, a year ago. Next slide, please.
Okay, so for us, what we've learned, I think, is that trust doesn't build by itself. So we've very carefully applied the principles and values in the 4 cornerstones self-evaluation tool. You'll probably be familiar with this, and I realise that you're all on co-production journeys and have got your own skills, knowledge and experience. But for us, looking at the welcome and care, value and include, the importance of open, clear and honest communication and working in partnership have built the trust that we've developed. But also we've had to do that internally and to ask ourselves some very rigorous questions about what does that look like? How do you change the culture of an organisation? And how do you change the way in which 2 organisations that were in really different places related to each other? So next slide, please, Sam. I think building trust is so easily spoken about, but actually the detail and the hard work and the planning and the forensic attention to detail, particularly in use of language, that builds this has been really, really important. The other thing I think it's really important to talk about is the amount of time it takes. So Amanda and I have spent hours together. There have been weeks where I think we've spent more time with each other than with our respective
families. Yes,
children.
that's true.
But you have got to build relationships, and that takes time. You can't do this as a tick box. And I think we've had to manage respectively the expectations within both our organisations, that we'd just be able to kind of have a parent care forum and all these things would just magically happen. And for both of us, we've had to have really difficult conversations about, well, we have got to do this in order, we've got to work this through slowly, we're on a journey, and no, we don't know quite what the destination looks like yet, but we know we're asking the right questions of ourselves and each other. So next slide, please. So I'm going to ask Sam to put the link in the chat for this, but if you could just open it up, Sam. This is the self-evaluation document that's been my absolute cornerstone for doing this work. So moving away from the idea of we're just all going to be really nice to each other and somehow the magic will happen, into a really forensic breakdown of what do we need to do and how will we know we're doing it. So this resource is open and it's shared on the internet, but it really breaks down how you do what you're doing in relation to co-production. So moving away from us as using co-production as an umbrella term and into the forensic detail. So making sure your voice is valued and heard. What does it mean? How might you expect to see it? And then how do you evidence it? So for me in the local authority, this has been really, really important. So do my staff feel able to contribute to our service days? Do they have regular meetings with their managers where they feel their voices are heard? What does co-production look like within a local authority meeting and setting? How do my staff feel safe? You know, how do they feel understood? So that we'll have some time at the end of this workshop to look a bit more at that, but I wanted to flag that up as just a tool that we found incredibly useful, and I know Amanda's done the same within the parent care forum, and it gives us a shared framework that we can keep coming back to. Next slide, please. We really wanted to share this video just about the importance of empathy and working together. I'm not sure the volume's working.
No volume. Is the volume coming through?
No.
No. Okay. I'll put the video link in the chat and people can have a quick look at it afterwards.
It's just a really nice one that we've both used to kind of think about, you know, how we use empathy to work together, and again away from the idea that it's just a lovely thing you can do, to being a discipline that you need to apply all the time and in every situation. So we wanted to use the workshop co-productively to share a little bit and to hear a little bit about how you might be using cornerstones, or whether this is work that resonates with you, and to think about how this is applied. So I think probably the easiest thing, Sam, is if we turn off the slides and bring people up on the screen, and then people want to share their experiences of working co-production, whether this is familiar to you, whether this is something different, or just tools you've used to actually go on your co-productive journey. So would it help if people put their cameras on?
Can't see you, Mary.
You can't see me?
Mary, you flash on and off a little bit.
Okay. I think that might just be my very poor Wi-Fi connection, sorry. So do people want to share a little bit about their own journeys in co-production and tools that they found useful, whether this resonates, whether it sounds like madness?
Or if you have any questions.
I guess a question from myself then, if that's okay. Obviously that sounds like there were some really difficult kind of discussions at the start. Did that threaten to kind of overload the whole process, did you find, or were you able to kind of break through those really challenging discussions?
I think at the point before the Parent Carer Forum was established, that probably would have been the case, but having an organisation now that can represent those views as forcefully as possible is still able to be done, and Mary will tell you I do it all the time. So do quite a few of the steering group members, but in what you need to realise is that this for us is life. This is, I often hear the term lived experience, which makes me smile because I'm still living and families are still living. And this is something that we live, we eat, we breathe, we sleep, you know, all aspects of life for a SEND family is what is impacted. And the one thing I'd like to say about co-production, which I often say to many officers in the local authority, is that it involves everybody, because we talk primarily about 0 to 25 when we're talking about EHCs, but you know what happens after 25? We still have adult services. Both my children are now adults. Their SEND aspect doesn't go away, but now we're talking about environment, we're talking about housing, you know, there's health. So everybody needs to be kind of in this together. That's what I know as true co-production. Sarah, your hands up.
Yeah, just sort of following on from that, I've kind of heard a lot about trust and building trust and overcoming these kind of barriers from, you know, what Sam was saying. I just wonder, you know, it sounded like, you know, you've got a lot of different people who've had all sorts of differing experiences coming with different views. How did that process of building that trust back up happen? How did you manage to do that? Because that seems like a really difficult thing to do when, you know, you've had people that have had really negative experiences.
We're still building. It isn't, you know, it's the brutal honesty about that is that we are still building, and it is a process. And sometimes local authority officers have to remind us, and there are other times that we have to remind them. And you know, there's a lot of initiatives and a lot of drive for change. So for somebody like myself, who, you know, my eldest child is almost 26, there are things that have been relaunched, and I kind of roll my eyes and throw my hands up in the air and go, well, I heard that 18 years ago, you're still talking about it now. Mary will attest to that. So the trust is still kind of being built slowly, but I think that in terms of the subgroups that we now sit on, the seat, you know, the tables that we now sit around has built, you know, it's been very helpful in building that trust. But like I say, you know, it's kind of early days, but that's something that's, you know, slowly but surely we've also got to build trust as a PCF with parents, because we've had some kind of parent carer forum before in the past, but it, you know, it didn't kind of survive. So this is where the split began, because we are funded in part by the DFE and the local authority. That also brings alarm bells for some parents, because, well, you're being funded, so, you know, you must be kind of doing their bidding and stuff. So it's an ongoing process, Sarah. Great question. Thank you.
I think it's a good question. I think Amanda, sort of, for me, it's about structures. So you have the structures in place. It's been a bit about using the 4 cornerstones forensically with my service. So how will you know this is happening? Go back to the impact on children, which I think somebody put in the chat. Are we seeing the systemic impact of this on the lived experiences of children, young people and families? So are our plans better because we're meeting more regularly with families? Have we got the right systems in place? From the moment somebody wants to find out something about SEND, is our local offer welcoming? Do people feel as though it might recognise them, given that we have really diverse community in Haringey? All of those questions all of the time, because I think building the trust is about fundamentally sharing power, making sure people around the table, making sure people have got support in place to enable them to do that. So the infrastructure support grant, I think, was really important in that. But I do think it's about the attention to detail, and sometimes when we're all busy that gets lost. And that, I think we've noticed, Amanda and I, that when things start to get a bit fraught, it's because a corner's got cut, a meeting invitation has gone out at such short notice, or it goes out at school pickup time, that sort of thing. You know, if you get your meetings at the right time, that goes a long way to people feeling like you actually want them there. It's so basic, isn't it?
There's another hand. Jane?
Hi. Hello.
Hi, Jane.
Hiya. I suppose my question's might be a bit controversial, really, but we've had a similar experience where a number of parent carer forums haven't lasted, and I'm just reflecting on what a huge job it is, what a massive expectation, you know, the Children and Families Act and the Code of Practice puts on parent care forums. As people are volunteers, very small grant offered, and yet our ask is huge. I mean, huge. And I'm just interested to think, you know, we could say, well, the answer is just throw lots of money at it, and that might be part of the answer. But I'm also interested to know what your thoughts are regarding a bit more of a strategic national. We've got legal guidance here. You know, we've got legislation, but where is the infrastructure? Where is the infrastructure other than little bits of grants, little bits of top-up funding? All feels very piecemeal to me, and I don't know whether the DfE have really realised how important, you know, they say it's important, but really how important is it? Where is the training, the support, you know, much more of that community engagement, is it capacity or resource? I can't think, there's a fancy word for it, and I can't think what it is. Because this isn't just about the world of SEND, is it? This is where as a society need to be going. It's not, you know, the people in dark suits sitting in cupboards making policy for all of us as citizens, whether that's within health, education, social care, the SEND world, any other aspect of what the public sector do. But, you know, I'm questioning whether or not this is sustainable, despite the fabulous, I'm not putting down anything you guys have done, because I think that's just remarkable, and we'll be in contact with you, believe me. But I do kind of question the expectation. You know, the genie's out of the bottle. And it's down to it is down to people being so willing to make that connection. But you can't be putting your life on hold. You can't be not seeing your families because you're spending so much of your time doing that. There's got to be that capacity from a community development point of view, I would think. I don't know what your views on that are.
No, I think you're right. And I think for us, the infrastructure support grant was really important. We were really pleased that the Parent Care Forum appointed the Bridge Renewal Trust, who are a community development voluntary sector infrastructure group in Haringey, and they just have practical things like offices in a nice central part of the borough, and good guidance around governance and things like, you know, how to organise your finances if you're a voluntary sector group and that sort of thing. Because I think you're right. I'm also the parent of a young adult with disabilities, and I just, hats off, couldn't do, you know, what a lot of our PCF do, and every time one of them gets a job I feel a little bit sad, because I know that's a little bit less capacity that they have to give as volunteers. But it is a movement of volunteers. I know, Mandy, I mean, you juggle all the plates all the time.
You actually hit the nail on the head, Jane, because that's the world I live in every day, and my mouth opens and I say that what you've just said at every possible moment. For different families, it's kind of different. With my personal journey, when my children were young, I just thought, oh, what happens when I'm no longer here? what happens to them. And when we're going back 2 decades ago, the services and assessments, etc., were not as prevalent as they are today. Mary and I do often joke about the amount of time that we spend. But if that, it might be a text, it might be a, and I'm very stringent about the time that I spend. I know everything that's going on because I'm CC'd into everything. But the team that we have we're very fortunate that they've got expertise in kind of different areas, so that really works. But it is a humongous ask, and without the assistance, I think, of the bridge renewal, it's nice to have a safe space where parents can congregate. We can meet as a steering group and stuff, but on the whole, it is a huge ask. To people often want me to come and speak at their at their support group, and I say, well, will the vice do? We can ask the vice chair or one of the steering group members, and no, Amanda, it must be you. The things like this are a kind of a huge demand on time and resources, and yeah, we might get a little remuneration, but it's not really payment for the kind of job that we're doing in relation to what, working alongside the local authority. And I think that certainly for Haringey, with the history that has, from the previous history, nobody really wants to put their head up again, above the parapet, or even say, well, yes, I want to be involved with that, because has been a lot of knockbacks. I'm probably one of the very fortunate few that don't bring my emotions to any kind of party. When I do, Mary will tell you it's very explosive. But I think until parents actually get to reconcile that within them, that, we are able to express what's gone on for them, how it is, we're going to have problems with capacity. We're going to have, all of the issues that you mentioned, Jane. What I do know is that the DFE really need to sit up and pay attention, because it isn't the case that all of a sudden, parents are trying to get an E8C necessarily because they want to get services for their children. We're living in an age where actually special needs globally is just on the rise. That's just the fact. And if we're going to keep our youngsters separate from neurotypicals, and kind of see them as different, we're going to be here having this conversation in 20 years' time. The DFE really kind of need to pay attention to these youngsters who are actually human beings and have just as much to offer as anybody from a mainstream environment.
Thanks, Amanda. Mary, is there anything you wanted to add? I will put the same evaluation survey link in the chat for people. It helps us to get a feel for how to make these events as good as possible. But Mary, otherwise I'll leave it for you to close.
Yeah, no, I just want to say thank you, everybody. It's always, you always learn more on these sorts of days than you've ever got to share. But any questions, anything people want to follow up, I think Sam's put the resources in the chat, but thank you very much. It's been really interesting.
Thank you.
Thank you all.
Everybody. Thanks.
Thank you.
Thank you.
You're welcome.